Good day everyone. In this pre-recorded video, I will discuss the dermal puncture. Advances in laboratory instrumentation and the popularity of point-of-care testing make it possible to perform a majority of laboratory tests on microsamples of blood obtained by dermal puncture on both pediatric and adult patients. Dermal puncture procedure is also performed when venipuncture procedure is not appropriate. In most institutions, dermal, which is capillary or skin puncture, is the method of choice for collecting blood from infants and children younger than 2 years for the following reasons. First, locating superficial veins that are large enough to accept even a small gauge needle is difficult in these patients, and available veins may need to be reserved for intravenous therapy. The use of deep veins such as the femoral vein can be dangerous and may cause complications including cardiac arrest, venous thrombosis, hemorrhage, damage to surrounding tissue and organs, infection, reflex arteriospasm that can possibly result in gangrene, and injury caused by restraining the child. Drawing excessive amounts of blood from premature and small infants can rapidly cause anemia because a 2-pound infant may have a total blood volume of only 150 milliliters, and certain tests require capillary blood, such as newborn screening tests and capillary blood gases. Dermal puncture may be required in many adults, including burned or scarred patients, patients receiving chemotherapy, who require frequent tests and whose veins must be reserved for therapy, patients with thrombotic tendencies, geriatric or other patients with very fragile veins, patients with inaccessible veins, obese patients, apprehensive patients, and patients requiring home glucose monitoring and point-of-care tests. Importance of correct collection. Correct collection techniques are critical because of the smaller amount of blood that is collected and the higher possibility of sample contamination, microclots, and hemolysis. Hemolysis may occur in dermal puncture for the following reasons: excessive squeezing of the puncture site or milking, newborns have increased numbers of red blood cells, and increased RBC fragility, residual alcohol at the site, vigorous mixing of the microcollection tubes after collection. Composition of capillary blood. The blood collected by dermal puncture comes from the capillaries, arterioles, and venules. This is a mixture of arterial and venous blood and may contain small amounts of interstitial and intracellular fluids. The composition of this blood more closely resembles arterial rather than venous blood due to arterial pressure. Warming the site before sample collection increases blood flow as much as sevenfold. Now let's discuss the dermal puncture devices. The Clinical Laboratory Standards Institute recommends that the incision depth should not exceed 2 millimeters in a device used to perform heel sticks. This is to prevent osteomyelitis or infection of the bone. Sufficient blood flow should be obtained from incision widths no larger than 2.5 millimeters. As you can see in the image below, the puncture site should only reach the capillary bed and not exceed to the subcutaneous tissue. These are examples of different kinds of lancets with a pricker system for dermal puncture. So at the right, this is an example of a contact activated lancet with pricker for finger puncture. And at the right, this is an example of a lancet with automated pricker for heel stick or heel puncture. And these are also some of the puncture devices used for heel puncture and or finger puncture. So for microsample containers, first we have the capillary tubes. So these tubes are used for microhematocrit tests. These are small tubes used to collect approximately 50 to 75 microliters of blood. So we have two types of these tubes. First we have the red band for heparinized tubes or anticoagulated tubes and blue band for plain tubes. So we also have the micro collection tubes. So this is just similar to what we have in the venipuncture procedure. So we have the following tubes: red, which is plain or no anticoagulant; green contains heparin as an anticoagulant; and purple or lavender, which contains EDTA. We also have additional dermal puncture devices such as alcohol pads, gauze, and sharps containers, which are required for the dermal puncture. A supply of glass slides is also required for blood smears, and warm washcloths or towels, or a commercial heel warmer for warming the puncture site and to initiate or promote blood flow to the puncture area. Now for the dermal puncture procedure, first we have the phlebotomist preparation. So the phlebotomist must have a requisition form containing the same information required for the venipuncture. When a sample is collected by dermal puncture, this must be noted on the requisition form. Phlebotomists should carefully examine the information on the requisition form to ensure that they have the appropriate equipment to collect all required samples. And phlebotomists should frequently perform dermal punctures in the nursery and must observe its specified protective isolation procedures, such as the wearing of gowns and gloves, extensive hand washing, and carrying only the necessary equipment to the patient area. Next is the patient identification and preparation. So the same procedure is utilized for venipuncture. So that's the verification of the requisition form, verbal identification, and checking of the ID band. In the nursery, an identification band must be present on the infant, and verbal identification of pediatric outpatients may have to be obtained from the parents. Next is patient position. So the patient must be seated or lying down with the hand supported on a firm surface, palm up, and fingers pointed downwards for finger sticks. For heel sticks, infants should be lying on the back with the heel in a downward position. Next, for the site selection, so the primary dermal puncture sites are the heel and the distal segments of the third and fourth fingers. Performing dermal punctures on earlobes is not recommended. The choice of a puncture area is based on the age and size of the patient. Areas selected for dermal puncture should not be calloused, scarred, bruised, edematous, cold, or cyanotic, or infected. Punctures should never be made through previous puncture sites because this practice can easily introduce microorganisms into the puncture and allow them to reach the bone. Do not collect blood from the fingers on the side of a mastectomy without the healthcare provider's order. For the heel puncture sites, so these are used for dermal punctures on infant younger than 1 year because it contains more tissue than the fingers and has not yet become calloused from walking. So the acceptable areas for the heel puncture are the medial and lateral areas of the plantar or bottom surface of the heel. For finger puncture sites, finger punctures are performed on adults and children over 1 year of age. Fingers of infants younger than 1 year may not contain enough tissue to prevent contact with the bone. The fleshy areas located near the center of the third and fourth fingers on the palmar side of the non-dominant hand are the sites of choice for finger puncture. Warming the site. This is very important for optimal blood flow, so the finger or heel from which the sample is to be taken may be warmed. This is primarily required for patients with very cold or cyanotic fingers, for heel sticks to collect multiple samples, and for the collection of capillary blood gases. Warming dilates the blood vessels and increases arterial blood flow. Moistening a towel with warm water at 42 degrees Celsius or activating a commercial heel warmer and covering the site for 3 to 5 minutes effectively warms the site. Cleansing the site. The selected site is cleansed with 70% isopropyl alcohol using a circular motion. The alcohol should be allowed to dry on the skin for maximum antiseptic action, and the residue may be removed with gauze to prevent interferences with certain tests. Failure to allow the alcohol to dry will cause a stinging sensation for the patient, contaminates the sample, hemolyzes RBCs, and prevents formation of a rounded blood drop because blood will mix with the alcohol and run down the finger. The use of povidone iodine is not recommended for dermal punctures because sample contamination may elevate some test results, including bilirubin, phosphorus, uric acid, and potassium. Performing the puncture. While the puncture is being performed, the heel or finger should be well supported and held firmly without squeezing the puncture area. Massaging the area before the puncture may increase blood flow to the area. So the image below shows the correct position for heel puncture. So the puncture device or the lancet should be punctured perpendicularly to the lines of the footprint. For the finger puncture, the finger is held between the non-dominant thumb and index finger, with the palmar surface facing up and the finger pointing downward to increase blood flow. For the disposal, after completing the puncture device should be placed in an appropriate sharps container. A new puncture device must be used if an additional puncture is required. For the sample collection, before beginning the blood collection, the first drop of blood must be wiped away with a clean gauze. This will prevent contamination of the sample with residual alcohol and tissue fluid released during the puncture. Blood should be freely flowing from the puncture site as a result of firm pressure and should not be obtained by milking the surrounding tissue, which will release the tissue fluid. Because collection containers fill by capillary action, the collection tip can be lightly touched to the drop of blood and the blood will be drawn into the container. For blood collection using capillary tubes and micropipettes to prevent the introduction of air bubbles, capillary tubes and micropipettes are held horizontally while being filled. Place the end of the tube into the drop of blood and maintain the tube in a horizontal position to fill by capillary action during the entire collection. When the tubes are filled, they are sealed with sealant clay or designated plastic caps. For collecting capillary blood using micro collection tubes, so these tubes are slanted down during the collection and blood is allowed to run through the capillary collection scoop and downside of the tube. Gently tapping the bottom of the tube may be necessary to force blood to the bottom. Tubes with anticoagulants should be inverted 5 to 10 times or per manufacturer's instructions. It is important to work quickly because blood that takes more than 2 minutes to collect may form microclots in an anticoagulated microcollection container. For the order of collection, the order of collection for multiple tubes starts with first, the capillary blood gases, second, blood smear, third, ether tubes, fourth, other anticoagulated tubes, and last will be the serum tubes. For labeling the sample, microsamples must be labeled with the same information required for venipuncture samples. Labels can be wrapped around micro collection tubes or groups of capillary pipettes. For transport, capillary pipettes are then placed in a large tube because the outside of the capillary pipettes may be contaminated with blood. Finally, for the completion of the procedure, a dermal puncture procedure is completed in the same manner as the venipuncture by disposing of all used materials in appropriate containers, removing gloves, washing hands, and thanking the patient and or the parents for their cooperation. All special handling procedures associated with venipuncture samples also apply to microsamples. Observe test collection priorities. As with venipuncture, it is recommended that only 2 punctures must be attempted to collect blood. When a second puncture must be made to collect the sufficient amount of blood, the blood should not be added to the previously collected tube. And that's all for the dermal puncture. Thank you so much for listening.